Good afternoon, everyone. Before I formally start the meeting, I'll go to each committee member to confirm they can hear and be heard. This is a legal requirement for me to do. So if you could verbally confirm that you're able to hear me, and I will confirm in response that I can hear you. Where practicable, please can you have your video switched on so that you can be seen by other members in attendance and the public watching. So we'll start off, it is going to be alphabetical, so Chris Baird.
Yes, I can hear you, Chair.
Thank you. Chris Burden.
Yes, thank you. I can hear you.
Thank you. Russell Hardy.
Yes, I can hear you.
Councillor Hitchner.
Yes, I can hear you. Thank you.
Councillor Norman.
Yes, I can hear and see. Thank you.
Thank you. Dr. Ian Tate.
Yes, I can hear. Thank you.
Stephen Vickers.
Yes, I can hear you.
And Karen Wright.
Yes, Chair, I can hear you.
I'd also like to request that the officers present also confirm they can hear and be heard. So again, alphabetically, John Coleman.
Yes, Chair, I can hear you loud and clear. Thank you.
Kate Cowtree.
Yes, Chair, I can hear you. Thank you.
Alistair Neal.
Yes, I can, Chair. Thank you.
We haven't got Amy Pitt here. Jen Priest.
Yes, I can hear you, Chair. Thank you.
And we haven't got Claire Ward or Michelle Wood, have we? No. Okay. Right. Again, thank you very much. And I'd like to welcome you to today's meeting. The Council is video and audio streaming this meeting live on the internet and making an official recording. The recording forms part of the public record for the meeting and will be available on the Council's website. Please note that while it is only a legal requirement that you have your audio switched on, it is the Council's preference that where you are able to do so, you also have video switched on. Please remember, what you say and do in this meeting has a global reach and your words and actions should be chosen carefully. Can I also remind members to ensure they are wearing the headsets while listening or speaking during the meeting? This ensures that the audio quality is of the highest possible standard and background noise is significantly reduced. As these are extraordinary times, there are some additional points for members and officers to be aware of. As part of our meeting etiquette and in line with our normal committee practices, all microphones apart from mine will be placed on mute at the start and during the meeting. I will run through the agenda in the customary way. When you wish to speak, please use the hand button against your name in the participants list, which should be on the right of your screen. I'll then invite you to speak in order of hands being raised. Please remember, unmute yourself to speak and mute yourself when you've finished. Please do not raise your physical hand, as I do not want to miss anyone who may wish to speak. Please also note that the chat facility has been switched off to ensure the members' contributions can be offered throughout the spoken voice and for the public record. Please ensure all mobile devices are switched off. This prevents interference with the audio and video system. If any attendees lose connection, the meeting will be paused to ascertain if the connection can be restored quickly. If it's not possible to recover the connection within a reasonable amount of time, the meeting will continue as long as a quorum of committee members remain and able to hear the proceedings and be heard. If you plan to leave before the end of the meeting, please could you indicate this in advance. Where committee members are required to vote on an item, I will ask each committee member in turn to indicate verbally if they are for, against, or abstaining. The results of the roll call will be recorded in the minutes of the meeting, where there is a requirement to record the named vote. If a committee member has not been present for the whole of the discussion on the item, due to technical failure, they should not vote on that item. Are there any questions before we proceed? Nope. Okay, so Item 1 on the agenda is apologies for absence. Do we have any apologies?
Chair, we've only received one apology for absence from a Julie Grant from NHS England and Improvement.
Okay, so has she sent a substitute?
No, Chair. No substitutes.
Okay, so item 3, declarations of interest. Are there any Schedule 1, Schedule 2, or other interest to be declared on the item on the agenda today? Please could you do this by raising your virtual hand, and then I'll ask you to speak to notify the meeting which item you have an interest in and the nature of that interest. Dr. Tate.
Basically, it's related to the public health debate, so I'm struggling to get both the agenda and the image on the screen. But the Karen Wright paper, it's because I'm a salaried GP working in the east locality of NHS Herefordshire, part of the Herefordshire and Worcestershire CCG. And then I'm also a shareholder in Taurus, which is the collective of GP practices in Herefordshire, which is specifically mentioned in the paper.
Thank you very much, Dr. Tate. Paul Smith.
Thank you, Chair. I just to let you know that I'm going to dip out now. That Stephen's arrived. I don't need to be present, so I'm going to dip out. But I didn't want to just leave because I felt that was discourteous. So,
yeah. Thank you very much for coming, Paul.
Thank you. Bye.
Thank you. Nothing else on there. Okay, so we're going to item 4 on the agenda now, the minutes of the previous meeting, which was the 10th of February 2020. No matters of accuracy have been notified to the monitoring officer. I'll ask each committee member in turn if they are happy to approve the minutes. Alphabetically again. First of all, it's Chris Baird.
No further comments from me, Chair.
Chris Burden.
Chair, as I didn't attend the last meeting, I don't feel able to do so.
Russell Hardy. I don't think you were there either, were you, Russell? Sorry, could you unmute yourself?
Apologies. No, I wasn't.
Okay, thank you. Councillor Hitchener. I know
Yes,
you
approved.
were.
Approved.
Thank you. Councillor Norman.
Yes, fine. Happy with those.
Thank you. Dr. Ian Tate. You happy with the minutes?
Yes, Chair.
Thank you. Stephen Vickers.
Yes, Chair.
And Karen Wright.
Yes, Chair.
Thank you very much for that. Item 5 on the agenda, to receive any questions from members of the public. Do we have any questions?
No questions received, Chair. Thank you.
And item 6 is to receive any questions from councillors. Again, do we have any questions from councillors?
No, Chair. No questions received from councillors.
Okay. Okay, so we'll go straight to item 7, the main agenda for today. Today's presenting officer is the Director for Public Health, Karen Wright. So I'll hand it over to Karen to introduce her item.
Thank you, Chair. Yes, there's a paper that has been circulated prior to the meeting commencing. And just some background to this, so that obviously we're all aware we've been in the COVID-19 coronavirus pandemic for the last few months. And we are now required as an authority, as an upper tier local authority, to produce an outbreak control plan. And I'll go into some detail, but this sets out how Herefordshire plans to both do its best to prevent, but also to respond to and to keep under control any outbreaks or clusters of cases of COVID-19 in our communities. And the task that we have at the Health and Wellbeing Board today is to seek the support of the Health and Wellbeing Board in establishing a COVID-19 engagement working group in accordance with the terms that are set out in the appendix of the paper. So So the alternative options that we have here, we can either choose for the Health and Wellbeing Board to take on the duty of being the COVID-19 engagement working group. They take on that function, and the purpose of that function really is to make sure that that we have an effective mechanism to engage our population and to keep them on board in actually doing, each and every one of us, whether a business owner, a member of the community, a care worker, all playing our role in helping to keep control of the pandemic moving forward, and obviously focusing on Herefordshire. And the engagement body is really about working with the public effectively. So in terms of the Health and Wellbeing Board could take on this role, or we can have the working group, which will be more agile in the way that we can actually set that up to be able to respond to situations as they develop. So the considerations that we set out in the paper are that as the government starts to ease the lockdown measures, that there are increasing risks of the spread of the virus within our communities. Clearly, there are decisions. There are factors that have been formed the unlocking of society, and that's a good thing that we're seeing now. But likewise, we're also seeing, for example, in Leicestershire, what happens if those rules aren't followed, and if we don't all work effectively as a community to socially distance, etc., to help prevent the spread of the virus. So we've been directed to establish an outbreak control plan and put in appropriate systems in order that we can both monitor the development of the epidemic and how that applies to Herefordshire, and also be able to use relevant data sources to inform that and to respond appropriately as we need to for Herefordshire. A resource has been allocated to the implementation of the plan, and locally that's 845,000. And importantly to mention at this part is there is the development of the national NHS test and trace service, which is a key part to the local implementation of the plan and obviously the national implementation of the plan. In terms of the monitoring of what we need to be doing moving forward and how we need to be responding to situations, we need to keep very clear focus on what's happening across our communities, but in particular in our high-risk settings. So in terms of our plan, there are 7 themes that we need to be working across, and we've set those out in our plan, and they include some of those high-risk settings, for example. So these are care homes and schools, high-risk places and locations within our communities, and locally we're aware, and you'll see from the national news, that things like food producers are high-risk settings, but also for Herefordshire, places where you've got seasonal workers, and that's because of the multiple occupation of living accommodation as part of the arrangement for those settings. So they are of particular interest and concern for Herefordshire. Within our plan and the 7 themes, we've set out how we're going to respond to those settings, and including schools and early years settings, working with children's and families, and obviously adults and communities and our partners, particularly with the NHS, who've been incredibly supportive of the approach to date. We also have to identify within the plan what our local testing capacity is, and we've done that quite robustly. And again, I think a public vote of thanks again to our colleagues, particularly from Wye Valley Trust, in helping us to work through what our approach will be. To establish contact tracing in support of the national system, in particular focused on complex settings. And again, we're looking in Herefordshire at going over and above where we need to be to support contact tracing within our local communities. Clearly, in order to be able to understand what's happening in our local area, then we rely on soft and hard intelligence. So we have the data around testing and the number of cases, and sadly also around the number of deaths. But we're also bringing together, and that's why the engagement board will be really important, is to understand what are the concerns across the whole or in particular parts of our communities in terms of people either not following social distancing measures or there are escalating number of cases of clusters, so individual cases within a particular geographical area or outbreaks where there are 2 linked cases. So bringing all of that intelligence together in order that we can respond appropriately to do our best to prevent and respond to outbreaks as and when they occur, and they will occur. That's the nature of the epidemic. It's very important as part of the plan that we maintain our support to vulnerable people, and the plan requires us to set out in particular if you have an individual who's become isolated, who has to self-isolate for the next 14 days because they're a contact, making sure that they have access to robust support, for example, if they need somebody to collect medicines or to provide food, as examples. The final part that's particularly relevant to this group is about creating the local governance, which is establishment of local boards, which we can call as we would like to do for Herefordshire. And at the end of the paper, it sets out what the structure is. So to take forward the plan, we need to establish a mechanism where we've got local members involved, and that's through the local engagement board. So the group has been required to fulfil a number of functions. So the COVID-19 engagement working group, that's what we're calling it here, the proposal is the democratic oversight of the local outbreak control plan, the development of it and being able to see that we are managing outbreaks effectively. Would have effective strategic communication with the public and about the management of outbreaks. And if we look at examples happening across the country, with Leicester, for example, how do we communicate with the public around what people's response needs to be, so that each and every person can play their role in keeping the pandemic under control and how it's affecting that particular area. The proposal is that the group needs to maintain understanding of and appropriate involvement of local powers to support the effective implementation of the local outbreak control plan. Some of those, the national powers are unclear at the moment, and some of that is becoming clearer day by day as we get guidance from national government. So the proposed terms of reference are set out in Appendix A for this particular group. But the key areas of responsibility set out in the paper are really assessing the progress of the plan, and there are it is a detailed plan is now being published to support, and this is really key, the stakeholder and community engagement to build trust and participation in the actual delivery of the plan, and that to me is absolutely key. So how do we work with different parts of our community so that people understand why it's important to follow the rules, how we challenge behaviours when actually there isn't that commitment to do that, and how we work with people so we get everybody on board, because that's how we'll keep Herefordshire open and help our economy recover, and and our children to get back to school and maintain their attendance at school. It's also about providing that leadership, and I think again that's absolutely key in the prevention and management of outbreaks through the local outbreak control plan, and that's by the behaviours that each and every one of us displays, but again how we can be part of correcting when there's misinformation, if we get a rumour that there's a big outbreak somewhere and there isn't, or actually it's okay not to follow the advice if you've been told to self-isolate. We as community leaders and particularly our members, I think, can play a really key role in getting those messages across. So moving down through the paper, what I'm proposing as point 15 is that the membership of this group obviously includes the members of this board, but also includes a wider political involvement because we need cross-party support to this, but also brings in representation from the parish councils, from other parts of the NHS system, from the Health and Safety Executive. They have a key role in terms of enforcement in particular property premises, environmental health, the clinical commissioning group, and we've included there particularly around that infection protection and control role because of their role with the service, emergency planning, and public health, but also bringing in some of the National Farmers Union, faith organisations, and those parts of the community who have a particular role to play in engaging local parts of our system. In terms of community impact, clearly it's really important that we get this right. We need to keep on top of situations, and we need to do our best to keep Herefordshire open and engage our community. We've been doing a fantastic job in supporting the implementation of local plans. I'm going to move down to the area around the resource implications. So there is an important to understand there is a grant that's associated with the implementation of the outbreak control plan, and we'll be working through the outbreak control group, which I'll come into their role in terms of the deployment of that resource, but to make sure we have a robust approach to implementing the plan. I've identified in the paper some key areas where we need to put some additional resource to make sure that we are robust in our response. In terms of the legal implications of the paper, those are set out, and that does bring into play the role of the Director of Public Health, but also use some legislation to support us in implementing the plan. So the consultees I've identified in the paper because they've been part of the outbreak control group and they've been cited on this particular paper. So if I bring you now to the proposed structure and terms of reference of the group, which apologies, I just need to open that paper. And you'll see from that the, sorry, apologies, that there are two groups that are being formed. There is the engagement working group, and the other key group that you can see there is the COVID management group, outbreak control group, and that has now been meeting for that's had its third meeting now, and what that group has been doing specifically is about that has been actually overseeing the development of the plan. And how that needs to be, that we are meeting the requirements in terms of insurance, but also reflecting what we want to be seeing for the system of Herefordshire. So just looking at Appendix A of the paper, and that what this paper sets out to you is proposing that the group will be the subgroup of this Health and Wellbeing Board, and reporting into the engagement working group will be the outbreak control group that I've stated has just been meeting 3 times. It's met 3 times already, and there's some colleagues around the table are part of that group. So the key functions around management of outbreaks are set out in the structure chart, and all those different boxes are not specific groups. So we have there's in order to implement the coordination functions, in other words, how we respond to outbreaks and managing the pandemic locally, then we do need to rely on specialist advice, make sure we've got the right equipment and logistics, and that's where Paul Smith has been key in terms of the provision of PPE, personal protective equipment, to people across the system. Engagement and communications, which clearly is the focus of the conversation that we'll be having now. Having the right data intelligence, and we've got Becky Howell-Jones has been leading that. She's a public health consultant, but again, working with colleagues in the NHS system to pull a really good picture of what's happening in Herefordshire, both geographically with particular populations and also in particular organisations in order that we can respond appropriately. We've set up an effective system in terms of supporting our care home market, and that's been expanded to include all of the different care providers from domiciliary care, but also other residential settings. So in order that we can again help them to prepare through prevention measures, but also be able to respond to outbreaks as and when and if they occur. In terms of our schools and our further education and early years settings, again, working with Chris Baird and from Children and Families, and also for Public Health and other colleagues, there is a robust mechanism for communicating with those schools settings, and they've each got their own plans, so they know how to respond as and when and if situations arise, and that is set out in the outbreak plan. In terms of our workplaces, it's important that we understand where our most vulnerable workplaces are, and those are being mapped as are other settings. That work has been done, and we'll start to be able to share maps so we can understand again what's happening in different settings and where do we need to focus our energies around prevention. But we've got a robust mechanism that if something does happen, we are able to do the preventative and supportive work for our businesses, and thinking about our agricultural communities as an example. We also recognise that there are other particular settings, such as places of multiple occupation that are used by, such as the arrangements for homeless and other defined communities. And again, we've got plans in place to be able to respond to if there are situations, also prevent those developing in those areas. So the principles of the governance arrangements are that we've got really good understanding of what's going on within the outbreak management plan, that we can be reflecting and learning. This is a new situation, improving as we go along, and that we have got that robust monitoring and oversight of what's happening at any given time. It's probably worth me mentioning that we do have a battle rhythm, as we call it, in place for the oversight and delivery of the plan, which involves a daily huddle to say what's happening at the moment, what needs to be done, and there aren't any areas of concern that we have at the moment in Herefordshire, which is good news, and let's hope it stays that way. So identified there the terms of reference of the engagement working group. So I've covered most of these points, but it's about providing oversight of the plan, making sure that we're building stakeholder support and engagement, providing that community leadership, supporting officers to deliver the plan, and making sure that we're able to do that effectively. So we may be calling on the support of that engagement working group to say, look, we really need to get some communications and engagement with a particular population. How can you help us to do that, and how we can do that together? It's proposed that the chair of the group be either the leader of the council, chaired by the leader of the council, and the member, cabinet member for health and wellbeing as the vice chair. In terms of the membership, I've outlined those earlier in the paper, and what we've identified here is pulled out what we think the roles of individuals need to be within the group. And then there's the kind of the working of the meeting. In terms of the frequency, we've identified that needs to be as and when required. If we're in a situation where there are significant events happening, such as Leicestershire, I imagine this group will be a lot more active, whereas at the moment it might be meeting. I suggest that we have a meeting and then put some of the flesh on the bones around that, but I'm thinking every couple of weeks at the moment, and then we'll review that until we've got a really clear plan of how we want to work, and particularly around the engagement part of the working with our communities. I've set out at the final part of the paper the role of the outbreak control group and the membership of that group. So again, it's about providing that advice and support to decision making when we need to escalate situations, and within our plan, as best as we can, we've identified where we would escalate situations beyond the council and beyond Herefordshire. So again, some of that guidance is not clear, but there are the factors that we take into consideration is where we've got multiple, you could have multiple outbreaks that are taking place within a given area, and where actually we're not able to keep control locally because maybe people aren't actually following the rules, or for whatever reason we need to escalate beyond the boundaries of Herefordshire, and where actions, for example, around lockdown may need to be considered. So the other roles of the group are set out quite clearly there. And I think pulling out as well, there may be a need to pull in mutual aid again. If you look at using Leicestershire as the example, they pulled in mutual aid to bring in one of the mobile testing units to do testing within Leicestershire through the regional system, and I've got an understanding of how that happened. So I think that's probably all, Chair, that I would want to make talk through at the moment. Shall I take any questions?
Thank you very much, Karen. Very in-depth piece of work there. Can I just kick off with a couple of questions? The first one is, how will the intelligence that we gather locally influence the national data gathering and vice versa? We've seen nationally, regionally and local media saying that national data sets have been at odds with our intelligence. So how will these working groups bring coherency to the situation?
Well, firstly, the data flow nationally has improved significantly from where it was, particularly as the test and trace system is now becoming more, is working more effectively. So I think that's the first thing that I would like to say. And I think there is also the issue that's been picked up around the Pillar 2 testing. So there's various elements of the testing programme, and that's one of the things that's been at odds with the national data. So we now have that local data. That's a number of the members of the public that have gone through and had their tests undertaken and having those results back. So I think some of the anomalies that were there are being ironed out through the national system. What we have done is we started to put maps together that bring all that intelligence together, and we're mapping that at the moment. So I think actually that problem is starting to be resolved. There is an issue that can happen when some of the data that's gathered nationally is all released in one tranche of data, so you could suddenly get a peak in data. But again, I think that is starting to be ironed out, and what is starting to happen is we're being told as directors of public health if that data is going to be released, so I can then start to warn you to say something's going to look different, this is the reason that it's happening, and this is what's happening at this point. But I'm confident, in the outbreak control group have seen quite a detailed mapping of what we are putting together through the intelligence team and the work with our NHS colleagues.
Okay, so in that respect, how will differences in the data between national data and local data be resolved, especially in relation to the lockdown advice that we'll be expected to give?
Well, what will happen is that we will have all our local intelligence, and if we get a situation that starts to escalate, then Public Health England and working with the Regional Biosecurity Centre, they will start to help us to get a really good understanding of if there's anything that we're not seeing and what's going on locally. And that's when, if we do get a big situation such as in Leicestershire, that's when you would be having conversations. This is what we're seeing, and having those conversations with the national system. I'm not sure if is that answering your question?
Yeah, thank you. And can I just ask one more before we open it up to everyone else? Who will have the ultimate say about the trigger point for when an area should go into this lockdown? Would it be the working group or our chief executive?
So the ultimate decision around that about using local powers is the chief executive, but that would be informed by the officer's decision, the officer's information in terms of the use of powers, and obviously in a conversation with others. But it would ultimately, that would be Alistair's decision. There will be, and this is where there is a lack of clarity at the moment in terms of at what point does it become a governmental decision and use of some of those powers. And I think there is learning from Leicestershire that I'll be getting some feedback on tomorrow, but that we're in no different place from any other authority in that some of that is currently being worked through as we speak at a national level.
Okay, thank you. It's just I'm very aware of that. These are the type of questions I'm going to be asked by the general public. So
Councillor,
thank you for
may
that.
I come back on you that one as well? And I think a really important message that we need to get over to our population is that the more that people follow the rules and they work with us, the less likely we are to reach the situation in Leicestershire.
Yeah.
And that, it seems unfair to pick on Leicestershire, but obviously it's quite topical. And there's a really important message here for businesses, that the more businesses actually comply and people go and get tested and follow the rules, the less likely the businesses are to have outbreaks within their organisations that then forces them to make very difficult decisions about closure or impacting on the businesses. So it's in everyone's interest to protect their businesses, their families, themselves and others moving forward.
Thank you. Thanks very much. Right. Are there any questions from other members or participants? We have Dr. Tate.
Thank you, Chair, and thank you, Karen, for a very comprehensive presentation. Just on a practical note, looking not just at Leicestershire, but looking internationally, there was a mention earlier of sort of food processing plants and other risk settings other than the traditional health and care settings in schools. Do we have already a mapping of those areas of highest risk or any sort of risk score, or will we literally have to discover as we go along?
No, we've done that mapping of those of those premises. We have done proactive engagement with as many of those premises as we can. And we've got a good example of working with one of those particular settings who actually some of the learning from that particular organisation I've been sharing with colleagues in other areas who have got outbreaks in food settings, because the work that's going on there is exceptional. So we are doing that. We want to do more. And I would like the engagement group actually to help us with that, to say how can we be even more proactive and also understand the issues of community spread and employers that are associated with particular businesses, because the businesses can do everything that they can do, but if we've got spread amongst employees within communities, we need to make sure we reach effectively to those communities, and we're doing well on that, but I think we can do even better.
And just as a supplementary, are we maximising our opportunity to use the appropriate languages for the different settings that are involved in Herefordshire, bearing in mind our complex migrant workforce at certain times, although I accept that will be different at present already because of the lockdown?
Yeah, so we have, the relevant materials have been translated into numerous languages, and they've been distributed out to relevant organisations. We have also got, we're working through Directors of Public Health Network. Birmingham have taken the lead in getting test and trace information, YouTube clips or video clips into different languages, so we've been doing that. We've got people with language skills within the team to respond, and we're also working with one particular employer to see how we can do that even better. And we're starting a piece of work with a student from Worcestershire University, again working particularly with migrant workers, to say actually how can we work with you even more effectively, again looking at language issues and focusing on how can we engage, and we have been doing that. Yes.
Thank you.
Thank you, Dr. Tate. We've got a question from Chris Baird next.
Thank you, Chair. Karen, just if you may, just say a little bit more how the primary and secondary school sector are engaged in this, please, if you can.
Yes, certainly. In terms of the whole approach, so working with your directorate and public health, what we have been doing is there have been webinars, there have been toolkits, there's been lots of engagement of conversations with representations from early years and across all of the school settings in helping them to prepare to get more children back into schools. And I have to say there's been a fantastic response. We've also got one of our schools that has been involved in a pilot of antigen testing to look out for positive cases, which is Riverside. So I think that's really fantastic that they have been doing that. And we've got there's a standard operating procedure that has been set up that will say actually if we get a reported of a suspected case or two or more or an outbreak in a school, that we know exactly what we need to do and how to respond. We've got all our schools mapped and we've got contacts for all of those settings in order that if we need to get in touch with them, we can do that effectively. So I think they've been really well engaged, and we need their engagement obviously through this group as well, in order that we say how do we work with young people, because there's some evidence, I think, as we can see it from other areas, that young people we need to really engage with. So it's called to follow the rules. We need them to be part of this to protect others.
Karen, it was quite an interesting comment on the news this morning regarding the school closures in Leicester. They're actually starting from Thursday, and Matt Hancock suggested the reason for that was because it was not appropriate to shut schools down straight away once you identified a problem. Do you think that's good advice?
Well, obviously each individual case is individual. I think in terms of if you've got a case within a school, our local approach, if you've got a suspected case, let's get people home That's what we'll do rather than wait until we get the result. It's easy to get people back in. And there are bubble setups within schools. So you would then respond to the people who are the contacts within that bubble. Would, if you got a case, that they would self-isolate, and obviously that in some schools that'll mean the whole school, because there's only one bubble because it's a small school. In terms of the decision around closing schools and the timing of that, I don't have the individual details of what's happening in Leicestershire, so it would be unfair to comment really. But what we have got in place is we've got our standard operating procedures that say what we are going to do locally. The advice for people to go home if they suspect cases is actually, that's earlier than is on the national guidance. That would be wait till you've got a positive case. My view is it doesn't hurt. The results come through quickly. Let's just get people home. And that's the right thing to do.
Thanks, Karen. Question now from Councillor Hitchener.
Yes, thank you, Karen. Do we yet know what sort of powers the Chief Executive will have? I guess the hope is that people voluntarily accept they have to take some action. So if it's a factory, they would hope the owner would cooperate. There wouldn't be any need to recourse to statute or anything like that. But is there any information about the powers to close streets, close factories, close schools, whatever?
Should I hand that one over to Alistair?
Thank you, and I think it's actually something that has occupied the minds of those in Leicester right now. The government has indicated that in the next 2 to 3 days it plans to bring forward specific legislation to enable wider spread closures to take place. What we know is that we're able to close down specific locations, specific buildings, and that would be on grounds of health and safety or environmental health concerns. But it's precisely as Councillor Hitchener is indicating, wider areas, what if it's a larger community spread that gives all of us in local government across the country greatest concerns, and that's what government is indicating it's going to bring forward urgent legislation to clarify. So we need to see what that turns out to be, but they've indicated it will be in the next 2 to 3 days.
Are there any other questions from anybody else?
Chair, I apologise. It's Russell Hardy. I apologise I can't raise my finger on my iPad. Could I just make 2 points? I think it's a very good paper, and congratulations to Karen and the rest of the team for pulling it together. As a point of principle, I would be keen on pushing as much responsibility down to the outbreak control group as possible to allow them to be agile and fast moving. The one thing I would counsel is that clearly, even in Leicester, the challenge of communication, even when it's clear what the levels of authority are, is the biggest challenge we have when we move away from a very simple binary social isolation 2-meter rule position. So I would counsel that any advanced thinking on the communication messages in advance of another outbreak would be time well spent.
Very good point. Yeah, thank you very much, Russell. Anybody else have any questions? Jane Ives.
I wasn't sure that you could see me. Hi there. Just a couple of comments really. One was very much to support the proposals, exactly the right thing to do. And I guess to comment on what Karen said about the partnership working, it has been really strong, and I think it's stood us in really good stead so far. And I think it's really been shown by the sort of some of the responses around nursing homes, the response into the local food processing, which has been a strong response. So so very much support, and we'll play our full part.
Thank you.
Thank you, Jane. Can I just ask one more question, Karen? How prepared are we for conducting and increasing the local test and trace in the county? And how does this work at the moment? And will it change under the new arrangements?
Yeah, so in terms of the testing capacity, if I just do that one first, We currently have the mobile testing unit that is run by the military at the moment at Merton Meadow, and the capacity there is to do, depending on what time they arrive, but at least 250 swabs a day, and they're able to do that, and that's booked through the national system. If you needed a test and you either phoned up to get a test or you went online, then that's the local offer that we've got, and that's the closest facility, and that will remain. If we had a situation where we needed, for example, to do mass testing in a particular setting, then we do have the ability to say that we need another mobile testing unit to go to a particular setting, and they will go and do that testing for us. So that's the first thing we do, and that's the example that happened in Leicestershire and also in Nuneaton. That's what they did. The mobile testing unit was deployed. So if I needed to tomorrow, I could get mobile testing, and within hours I can get them there, and the results are coming back quickly. So we have the assurance, and nationally that's the system that's been put in place. If there was a huge surge, there is also additional surge capacity within the region to pull in more of those mobile testing units, and there are 50 units altogether, I think it is now, across the region. It's also worth mentioning that there is also another mobile testing unit in Ludlow. So again, that's close to our borders. So if somebody lived up that part of Herefordshire, that might be that's where they selected to go. If we needed to do the swabbing in care homes, we have the system we have in at the moment will remain through July. And what's going to happen beyond July, because at the moment we have the CCG have a contract with a private company called Prometheus, who've been doing a fantastic job, and they've been supporting the whole of the swabbing effort, and we may continue with some of that contract moving forward, but I don't think we'll need it. So the other work, and again working brilliant with the CCG and with Wye Valley Trust that we have in place, is that we will commission our own, we'll have our own mobile swabbing team, and Wye Valley Trust are supporting with that. They've currently got swabbers who go to Point 4 to do the NHS and social care staff, and we're working so that that team will able to be deployed again to help particular situations. And if it's not an outbreak, but we need to get a few people tested in an area, we'll be able to do that. So that's, I think, another example of great joint working. The thing that you need to be able to do this is laboratory capacity, because there's a swab, which is the actual, the kind of swab that's taken in the nose or throat, but there's also then what happens to those swabs. So in terms of our laboratory capacity, we've been incredibly well supported by Wye Valley Trust, who've identified that they have capacity. There is also some capacity at Worcestershire Acute Hospitals Trust if we need to call on, and we're working with Worcestershire on this, and we know that we have 50 laboratory, we'll be able to take it 50 to Heartlands Hospital. So if we need to use those, I know this is getting into detail, but gives you assurance. And the final thing is, if you have got an outbreak, Public Health England have a duty to organise swabbing, and they have both the swabs, we provide the swabbing team, and they also have the laboratory capacity. So I feel assured that we're in a really good position, and a lot better than I've previously been able to report to, certainly to Cabinet. In terms of the contact tracing, we want to go over and above the national system locally. So as a duty, we have a duty to follow up complex cases where the national testing system, who do the kind of more straightforward people, or Public Health England aren't able to contact somebody. So that may be because they're not responding. So if you had an example of an individual who wasn't responding to say they were contact, but we know they work in a food processing place, for example, a complex setting, we would definitely need to be getting hold of that individual. So what we might be doing locally is be told, actually, can you go and follow this individual up, find out where they are, to make sure that they're aware that they need to be followed up as a contact and to be following the rules. So we're backing up that system, but what we're also doing is, when we're getting local intelligence that we know we have got positive cases, that we are putting in the process, and that this happened the weekend actually with a case, to phone those individuals and to say, actually, can you tell us who the contacts are, and follow up those contacts, just in case the Public Health England or the national system doesn't step in as quickly as we want it to. In the particular individual case, by the time I'd phoned the individual to find out who the contacts were, the national testing system had phoned up, they got the contacts, I followed that up, and that worked really well, and that was in the matter of a couple of hours. That gives you assurance. We are also looking through the outbreak control group and we need to work this through at seeing if we will follow up people who are symptomatic but have not yet got a positive test, people identified through primary care, but we need to work that one through. But there's quite a strong commitment that we see if we can put in that in place locally. The additional thing that we want to do locally, once we've got the details of contacts, is to get in touch with people on a regular basis to say, are there any issues that you've got? How can we help? But the other important thing is that if we contact people in Herefordshire and we phone their home number several times and they're not there, then we want to know why, because if that's because people aren't following the rules, they're not protecting themselves and they're not protecting others. So we will then want to be following people up to see what's going on here, and working with workplaces to say, actually, as individuals who should be self-isolating, are they? So we can do the best to protect the Herefordshire population. So some of that's still work in progress to go over and above the national system, because there are things to work through, and that's been looked at by the outbreak control group.
Thanks, Karen. Can I just ask, do you have any idea of how long the Merton Meadows site's going to be working?
So I'm going to a briefing about all of this tomorrow as part of Directors of Public Health regional meeting, but we know that's going to be there is certainly until the end of July. That will be there for the long term. Whether it will be run by the military, that's the thing that is going to change, and I'm going to be finding out more details tomorrow and how that will be working. And that's hence why we also want to make sure we've got a swabbing team. So if we need them to be supporting that or doing swabbing as part of that offer, but we know that it is there until we need it, and we will always have access to one mobile testing unit. If we choose to move it because it makes sense to move it to another area, that's within the control of the Director of Public Health.
Thank you. Dr. Tate, you wanted to raise another point.
Just a quick one, really. Shielding has been an issue, and obviously picking up Russell's point on communication, shielded people are gradually getting the confidence to do slightly more under the national guidance. Clearly, I'm guessing, I mean, they're suggesting Leicester has taken 11 days to work up the case. I'm guessing if we had some local intelligence, our response would be potentially a lot faster than that, picking up some of the responses to Councillor Crockett, our chair's comments. So would we have any way of at least giving people a slight warning that we're investigating more so that they can make an individual risk assessment for this most vulnerable group?
And we will, because we know where our shielded people are. So we are able to write to those people, and we have previously done that. And I think you make a really important point about why we need the engagement group as well, because the more that we've got boots on the ground of people in communities who know people who can be getting the right messages out, the better that we can do that, and using a whole range of different media. And Alex Floyd has put together a really comprehensive communications plan to support this. But I think picking up on your point of understanding particular communities and how do we best communicate with them. And to date, we've had really good support from local radio, from newspapers. They've been tweeting, using a whole range of different media, but again, and through the people like the link workers who support in Talk Community. So we've got multiple ways that we can do that. And also, again, our intelligence is really good, but the soft intelligence is really important as well, that we need to keep bringing that into our system.
Thank you.
Councillor Norman, you would like to ask something?
Well, in fact, it's just been raised. I was just going to say we have this network of volunteers and support people within the community. I was speaking this morning to our Leominster liaison group. We meet every week, and local ward members, town council, volunteer representatives, Talk Community representative. It's a wonderful network, and I think each community knows their own area pretty well, so it makes sense to absolutely to use that, as you've just said.
And absolutely, I think we could have all test, trace, all of those other things, but I think that community leadership and those networks will be the real thing that will make the difference, of people following the rules, feeling able to, if they're struggling, being able to phone somebody, text somebody, WhatsApp somebody, say I need some help here, and that we just make it normal that we all do follow the rules because it's the right thing to do.
Thanks. Thank you, Karen. just one final one from me, really. You did mention about prevention. So on the basis of prevention is better than cure, how much of the working group's time will be directed to preventing new infections as opposing to reporting on them? You know, we see that warm spells of weather coincide with pubs opening, restaurants opening. Are they going to be highlighting these concerns in the group?
Absolutely. Again, the engagement group would help us with that, but the outbreak control group, and in fact the work of certainly public health and many other colleagues, has been absolutely focused on prevention. And that's the most important thing that we can do. So it really is focused on prevention. And perhaps haven't, covered that as well as I could have done. But we've done proactive work with, with businesses and communities. Through yourselves, that's what we need to be doing. But no, a point well said.
Thank you. Thanks very much. Are there any other questions? No, I think everybody's happy with everything now. So, well, we'll move on to the actual recommendation then. So the recommendation is that the Health and Wellbeing Board agree to establish the COVID-19 Engagement Working Group in accordance with the terms of reference set out in Appendix A. So I'd like to go through each member to ask them if they agree with that recommendation. So we'll go alphabetically again, and Chris Baird.
I agree, Chair, but could it just be checked out with the group whether there is indeed primary and secondary representation meant to be on that group? Karen, I know we've been discussing that, but I couldn't see that in the actual terms of reference.
Of course.
Yep. Chris Burden.
I support the recommendation.
Thank you. Russell Hardy.
Agreed.
Thank you. Councillor Hitchener.
Yes, I support this as well. Thank you.
Thanks. Councillor Norman.
Yes, happy to support this.
Dr. Ian Tate.
Absolutely support it. Thank you.
Thank you. Stephen Vickers.
Supported, Chair. Thank you.
And Karen Wright.
Yep.
And I thoroughly support it as well. So that will be. Can we add that into the recommendation about the schools then? Is Karen going to do that? Or
yeah, yes, I can do that. And Chair, with the proposed first date of the first date of the first meeting, apologies, is proposed for the 6th of July.
Yeah, that's fine. Okay, so finally, before I formally close the meeting, can I check that with the Democratic Service